It seems like every few years, ADHD ends up back in the spotlight, usually for the wrong reasons. Some influencer goes viral claiming ADHD is not real, that it's just bad parenting or bad science, too much screen time, or lack of discipline. And while those takes might get clicks, they don't reflect reality. For the millions of children and adults struggling every day with ADHD, this kind of denial is not just frustrating, it's harmful. I'm Dr. David Danish, a double board certified psychiatrist specializing in psychiatry across the lifespan. And today, I'm cutting through the noise to talk about what ADHD really is and what it is not. Because the truth is much more complex and more hopeful than either side of the online debate tends to admit. Let's dig in. Let me start here. ADHD is a legitimate, biologically rooted neurodevelopmental condition. That means it begins in the brain and affects how people develop over time, starting as an infant. We may not have a blood test for ADHD, but the neuroscience is still very clear. Large-scale brain imaging studies, like one published in the Lancet Psychiatry, have found consistent structural differences in areas that control emotion, attention, impulse regulation, and emotional regulation. Specifically, areas like the amygdala, the caudate nucleus, and the prefrontal cortex show differences in volume or function compared to neurotypical brains. These changes are especially tied to things like executive functioning, which helps you plan, prioritize, and follow through. And it's not just genetics. Environmental factors during pregnancy, like exposure to pollution, nicotine, certain toxins, or even high stress levels, also raise this risk. Kids born preterm or with low birth weight face much higher odds as well. So no, this is not a myth, and it is not about laziness or bad choices or over-medicalization of our country. It is a real condition with measurable brain differences and developmental roots. In my clinical work across all levels of care, all ages, all cultures, I've seen this up close. I've worked with children who can't hold back their impulses, and when those impulses turn into uncontrollable rage, it terrifies their parents, their friends, their teachers, and themselves. I've seen teens break down in tears because they want to succeed in school, but they simply can't absorb or organize information the way other kids do. They end up believing they're stupid, when in reality, their brains are just wired differently. I've treated young adults who desperately want closer friendships, more friendships, any friendships, but their social impulsivity, blurting things out, interrupting, acting without thinking, leads to constant rejection. The loneliness that follows can be crushing. And I've seen marriages fall apart under the weight of untreated ADHD, where poor impulse control, emotional dysregulation, and basic forgetfulness are mistaken for selfishness or indifference. This isn't just a list of personality quirks. These are real, life-altering impairments that affect people in significant ways. Research even shows that untreated ADHD is linked to higher rates of substance use, accidental injury, and even earlier death. That's not fear-mongering, it's evidence. And here's something else that's been proven in study after study. When ADHD is properly treated, especially with stimulant medications, which are the strongest, rates of substance abuse drop dramatically. So while some still argue that we're over-pathologizing personality traits, I can tell you from both science and professional experience, for many people, not all, these are not just mild personality traits. They are complex variations in brain chemistry that respond well to real evidence-based treatments. Now, here's where it gets even more interesting. Just because ADHD has a biological signature doesn't mean it's a broken brain. A growing body of research and voices from the neurodiversity movement, including my own experience with all of my patients, suggest ADHD traits might have been adaptive in other contexts. Think about it. High energy, quick scanning, curiosity, and risk-taking could have been survival advantages in the fast-paced or unpredictable environments of our ancestors. In fact, some evolutionary psychologists argue that these traits may have been exactly what early human communities needed, especially when it came to things like hunting, spotting danger, or exploring new territories. That does not make ADHD a superpower all the time, but it does remind us that brains are not a one-size-fits-all, and that what is considered a problem often depends on the environment. So all that to say, even though ADHD can be seen as part of a normal neurodiversity, that does not mean it's not a disorder when it starts interfering with life in the context of our culture. And in today's world, where we ask kids to sit still for hours during the day, expect workers to multitask flawlessly, and rely on phones to manage our time, people with ADHD often struggle more than ever. That mismatch between brain wiring and modern life is where a lot of pain comes from. The problem is not ADHD itself for most people. It's what happens when we don't recognize it, support it, or treat it. Because denial, saying, it's not real, everyone has it, or just try harder, leads to misdiagnosis, internalized shame, and lost potential. You've probably heard that many successful entrepreneurs, athletes, and creatives have ADHD. That's not a coincidence. When ADHD traits are understood, supported, and channeled, they can fuel innovation, passion, and outside-the-box thinking. But here's the key. Those strengths do not flourish in complete chaos. They need structure, self-awareness, and often some form of treatment. And remember, treatment comes in so many different flavors, whether it means behavioral therapy, family therapy, executive function coaching, lifestyle changes. The goal is not to fix someone with ADHD. It's to help them harness their potential without getting lost in the overwhelm. That's why coaching for executive function is so valuable, especially for college age, grad school age adults trying to manage ADHD in a world that wasn't designed for their brains. So let's please stop pretending this is a binary conversation. Almost nothing in mental health is binary. ADHD is not fake. It's not purely a superpower. It's not about meds versus no meds. It's not a question of, is it a real disorder, or is it just a difference in our brains that's not necessarily needing to be brought up? It's both. It's all the above. ADHD is a spectrum of brain-based traits, some challenging, some advantageous, that can lead to real suffering and real success, depending on how we understand and respond to them. Denying the biology, denying the psychology, that's dangerous. But denying the strengths, that's limiting too. Let's meet ADHD with science, empathy, and individualized care. And if you're looking for more resources, I put together a guide on executive function coaching for ADHD, plus a list of effective supplements that can help people who have ADHD. And you can check out both for free at drdaviddanish.com in the Mind Vault section. Remember, ADHD is not a character flaw, it's not a failure, it's not made up. It's a different way of experiencing the world that is very real. And with the right supports, it's a way that can thrive. Make sure to subscribe if you want more science-backed, balanced, stigma-free mental health content, and share this video if you know someone who could use a little clarity in the chaos. Take care of your mind and each other.